Hello everyone, this is Mehak Jain and I'm back with yet another video, and this is Straight Talk with Dr. M. Let's talk about certain modifications that we can make to our dental office which doesn't break the bank and helps in the post-COVID era. It's been 3.5 weeks now that I have been back to work, and I must tell you, I have enjoyed every minute of it, more so because this time around I'm having patients who are actually thankful that we are open, and I have not heard anybody said, "Oh, I hate dentists," as soon as they sit in the chair so far. So that's a victory. Okay guys, let's get back to our modifications. One thing that we want patients to do is limit their companions when they come to our office now. If there are any companions, let's offer them a mask. You also want to remove as many items as possible from the waiting room, like toys, books, etc. You of course want to put your chairs 6 feet apart. If your office has an ability for the patients to notify you when they arrive, that would be awesome, because then you can limit how many people are in the waiting room at the same time. You want to have a sneeze guard kind of guard in front of your front office personnel to protect them from any sneezes or cough. I have a sample for you guys to see what it looks like if you're not familiar, and it is nothing but a giant version of this. So it's a plastic sheet with 2 cords attached to the roof, and my sample has pink cords just because. You must consider giving the pens away to the patients which they use to fill their paperwork out. In our office we put 2 tumblers labeled dirty pen and clean pens, like so, and the patients use pens from the clean and drop into dirty pens, and then one of our staff members would go and clean and wipe the dirty pens time to time. Your waiting rooms should be equipped with trash cans, sanitizers, and tissue papers for the patient. In our office, we request every patient to first wash their hands and then come and sit in the waiting room as soon as they arrive, and that just takes the bioburden off. There is a pre-screening form. We have adopted it from the ADA website, and I'll be sure to link it below. We definitely take their temperature from no-touch thermometer. It really helps to rule out people who might have fever. Those are definitely not the right candidates to be seen at this time. Now, your front office personnel, people working in the front, should wear masks but should not wear gloves. I repeat, should not wear gloves. These are nothing but source of contamination because they are really touching many surfaces at the same time. It is hard to keep your gloved fingers from your face, from your phone, because it rings all the time. You are touching so many surfaces and you are cross-contaminating germs from one to the other, and you just psychologically think you are protected, but really you're contaminating yourself and others. So it is best to keep washing your hands frequently. Now let's talk about clinical areas. It goes without saying that you are wearing your PPE and washing your hands thoroughly. I'm sure you guys are now bored with all the PPE and the hand washing videos, so we're not going over that. You must exit the room always wearing your mask, even if it is for a brief 1 minute. Patients should be offered pre-rinse with a diluted hydrogen peroxide. Limit paperwork in the clinical work area. Use high vacuum suction, and I would highly advise using rubber dam as much as possible. This is probably the most efficient way to limit the aerosols. Now some other quick notes. Let's talk about clothing. So we wear scrubs in our office. So my advice is that you change into scrubs every time in the morning when you come in the office, and you change out in your regular clothes before leaving the office. So you can pile up your scrubs for 7 days in a sealed bag, and they all can go into laundry together. You may separate your working shoes with your regular shoes and then just wash them or wipe them with disinfectant as needed. And that is it for today. These were just simple modifications that everybody can do in their office. I'm sure you know most of them, but it's just good to put it forward just in case you missed one or two out of them. Thank you very much and see you next time. If you got any value out of this video, please consider subscribing.